Hey guys, so we're going to use a mobilisation technique using a mobilisation belt to encourage an increase in knee flexion. This is particularly useful for patients who have just had an ACL reconstruction and they don't have that end range of knee flexion, which is really common, and we know it's so important to get that end range. It's one of the key critical components of their rehabilitation. So let's just say that this person can't get past, say, about 90 degrees. We're going to use that as our starting point. Using this belt, we've got a loop. We're going to put the loop underneath the sole of their foot, cross the belt over and create an opening. They bend their knee up into the opening. That creates a little ribbon shape crossover on the front of their ankle, which supports that foot and ankle. Then they hold onto the belt at the top end, and they're going to use that belt to create a passive overpressure. So if we start further out, they can pull on that belt and it slides their knee up into flexion to the point where they can't sort of go any further due to either the pain or the stiffness in that joint. What we're then going to do is encourage the natural or normal, optimal arthrokinematics at the knee. So what should happen here is, if this is the femur, this is the tibia, as they move into knee flexion, the tibia glides posteriorly around those condyles and slips in behind the femur. To get full range, that's the arthrokinematic glide that we want to happen. For the person who's quite stiff in the joint, they'll come around those condyles, but at a certain point they'll get stuck and won't slip far enough posteriorly to get end range. So our job as the mobiliser is to push on that tibia and encourage that little bit more posterior slip as they come up into that knee flexion. So we start them out at that mid-range point, and then we ask them to passively, with the leg, actively with the arms, pull that knee up into flexion. My pressure then is creating a force across the top of that tibial plateau, so the webbing of the hand sits just under the tibial plateau, across the front, and we want to encourage that tibia to slip posteriorly along the femur. So we have to make sure that our line of force isn't a squashing force pushing the hands together, but instead it's a compressive force that glides the tibia behind the femur. So we start again out here, it pulls up into that flexion. As I'm gliding, I'm trying to encourage that pressure. You'll see the angle of my forearm changes to match the angle of the femur, and stop. And so we want to push that tibia and try to glide it behind the femur to the point where they physically can't go any further. In most cases you won't have a lot of pain with this. It'll be more just like an end range, almost a really solid stiff feeling. We want to find that end range and see if we can encourage a little bit more on each repetition. So we'll go again from midpoint. There he glides up, and I'm pushing along the top of that tibia, trying to get it to glide posteriorly over that femur, and then relax. He comes back out, and we can repeat that a number of times. And what you'll see typically is you'll see a real noticeable or measurable change in knee flexion with each repetition. You want to keep doing that until you feel like you're not getting any further, and that will be the completion of that technique.